সুপ্রিয় দর্শক সবাইকে শুভেচ্ছা জানিয়ে শুরু করছি দেশ টিভির সরাসরি এবং নিয়মিত স্বাস্থ্য বিষয়ক সম্প্রচার স্বাস্থ্য কথা অনুষ্ঠানটিতে। আপনার স্বাস্থ্য এবং স্বাস্থ্য সংক্রান্ত যে কোনো সমস্যা এবং তার সমাধান নিয়ে প্রতি বৃহস্পতিবার ঠিক এই সময় আপনাদের সাথে থাকছি আমরা, এবং আমাদের সাথে থাকছেন একজন বিশেষজ্ঞ ডাক্তার। আমাদের আজকের বিষয় ইনফার্টিলিটি অ্যান্ড ট্রিটমেন্ট। এই বিষয়টি নিয়ে কথা বলবার জন্য আমাদের সাথে আজকে স্টুডিওতে উপস্থিত আছেন ডক্টর অরুণ মুথুভেল, রিপ্রোডাক্টিভ মেডিসিন অ্যান্ড সার্জারি, ঈশ্বরিয়া ফার্টিলিটি সেন্টার, চেন্নাই। সুপ্রিয় দর্শক, আপনারা চাইলে সরাসরি ফোন করে কথা বলতে পারেন আমাদের আজকের বিশেষজ্ঞ ডাক্তারের সাথে। আমাদের ফোন নম্বরগুলো হচ্ছে 83325098, 83325754। দর্শক, আমি আবারও বলছি, আপনারা চাইলে সরাসরি ফোন করে কথা বলতে পারেন আমাদের আজকের বিশেষজ্ঞ ডাক্তারের সাথে। আমাদের ফোন নম্বরগুলো হচ্ছে 83325098, 83325754। Hi Arun, how are you?
Yeah, fine.
It's our immense pleasure to have you in our show today. Yeah. Okay, we are going to discuss about infertility and this treatment, which is called in Bangla that bondhotto. Like the word is came from that bondhotto is infertility. So today's topics is actually we are discussing that we will discuss about IVF, in vitro fertility. So before going to that topic, I just want to know from you that in case of infertility, we have a definition in our country, like the global definition is the same. But what you actually consider about, or what, as you are working in a fertility center, so what you consider as infertility?
Okay. What we see is that when a couple is married and the female has a regular cycle, they should try to conceive for at least minimum of 12 months, 1 year, or at least 1.5 years. And if they don't become pregnant, we label them as infertility. Suppose the women has irregular cycles, we don't consider that as infertility. We make them ovulate every month using tablets or injections. They have to try continuously for 12 months, and if they don't conceive, then we label them as infertility.
Infertility, okay. So the definition in Bangla, it comes like বন্ধত্ব মানে হচ্ছে যদি আমরা কোনো একটা কাপলের যার কোনো মাসিকের সমস্যা নেই বা মাসিকের সাইকেলের সমস্যা নেই, তার 1 বছর চেষ্টা করার পরও যদি তারা বাচ্চা ধারণে সক্ষম না হন, তাহলে আমরা তাদেরকে ইনফার্টিলিটির ক্যাটাগরিতে ফেলবো। এবং যাদের মাসিকের সমস্যা আছে, তারা যদি ওষুধ খাওয়ার পর তাদের সাইকেল রেগুলার হওয়ার পর তারপর যদি 1 বছর সময় পার করার পর বাচ্চা না হয়, তাদেরকে আমরা আসলে এই ইনফার্টিলিটির ক্যাটাগরিতে ফেলবো। Then I just want to ask you that what is the indications of starting the treatment of ovulation induction drugs or things? What are the signs and symptoms you consider that you will go for the drugs or you will go for the injections or other medications?
Okay. First, what we do is that if the female doesn't have regular cycles, we have to evaluate what is the reason for irregular cycle: overweight, thyroid problem, prolactin problem, hormonal problems. So we have to correct that first. Even after correcting, some women will not ovulate. They will not have regular cycle every month. So first step will be to use tablets. So ovulation induction, oral tablets. So we have to use oral tablet for at least 3 to 4 months. If the tablets are not working, then the next step is to add little injections in the cycle and try for another 3 cycles. Even if that is not working, you have to use more injections, exclusively injections from second day of cycle for at least 8 to 9 days. So this is a step. So we generally
this is the normal protocol. But in case of male, if there any is there any evaluation of male you do?
Yeah. Whenever a couple visits an infertility clinic, the first step is to definitely do a semen test, semen analysis. So you have to look for the count, motility and morphology. So this is very, very important.
So the thing is not only the women are the concern, also the male are the concern, because now in our country like ours, also in India, in some states, that always they accuse the women for the infertility. But nowadays we know that the 50-50 are the involved in infertility issues. So in case of drugs, if you are saying that if you give the ovulation induction drugs, what is the indication? Like what are the issues happens when you are using the drugs? When they came to you, what are the signs symptoms they say you, or you choose the drugs, or you sometimes some doctors give direct IVF indication. That is another cases. But if a couple comes to you, if you go for the ovulation induction drugs, what are the indications?
Okay. So ovulation induction generally is given 1 to 2 years of infertility, or maybe 3 years. We don't suggest IVF at all. So first step is evaluate all the causes, hormones, all these things, semen count, everything rule out. The next step is to evaluate the tubes. Make sure both the tubes are open. Then next step is to go for
After
ovulation
trying
induction.
1 or 2 years, if they come.
Correct.
Okay.
So we try ovulation induction. After exhaust say 1 year or 2 years of trying naturally, if they don't conceive, we start ovulation induction. But suppose if the couple gets married very late, say they are 35 years old, they get late marriage, we start ovulation induction immediately, even after 6 months. We don't wait till 1 year or 2 years. We
Okay.
start in
Okay.
6 months
So this
also.
is another point, that not always you suggest like 1 year indication induction.
Exactly.
When if the couple are aged, if they get late marriage after 30 years, when the high risk pregnancy happens, then you go for after 6 months the inductions.
Correct.
They you do you ask them to try for 6 months or more than 6 months that time?
No. When the women's age is more than 35, we definitely advise them to try for naturally for 6 months, not more than that, because as the age goes higher, the number of egg comes down. So we shouldn't ask them to try naturally for a long time, then we'll risk losing the eggs.
Okay, okay. So that's why you ask them to try for at least 6 months, then come to use.
Correct.
Okay. What is the indication of injections? Why you go for the injections if the drug fails? This is a common problem. But what are the other issues that you go for the injections?
Okay. There are two reasons. One is women, they develop resistance to the oral ovulation drug.
Okay.
Other one is failure. The tablet will work, but pregnancy will not occur. That is drug failure, resistance failure. So for both these reasons, we have to go for injections. That is one thing. And whenever
So how you evaluate these things, that drug failed or drug resistance developed?
we have to use it for at least 3 to 4 months. Only then we'll be able to know. Without using, it's very difficult to predict. And one more thing is, when the women's age is more than 30, it's better to use injections directly with little tablets. If the women's age is less than 30, start with tablets. So whenever there is less time, when the age goes up higher, start injections. When we have plenty of time, age is young, use tablets.
So is there any side effects of injections or anything of using ovulation induction tests without proper monitoring?
Yeah, definitely monitoring is required. Sometimes what happens is, when the women is thin built, young patients, if you use tablet, they may hyper respond. Instead of 2 or 3 follicles, they may develop 10 follicles. So there will be enlargement of the ovary, so it's risky. So definitely monitoring is required. That is one thing. One more thing is, if you use injection, there is a very high chance of hyperstimulation. So you have to definitely monitor. Monitoring, there is no excuse for monitoring. You have to monitor.
So you have to the monitoring system. You always suggest them by your follow-up procedure, or you say just to do the ultrasonograms by themselves?
Monitoring, easiest is by ultrasound. In a country like India and Bangladesh, definitely ultrasound is not very expensive. So monitoring by ultrasound is okay. Whereas in Western countries, ultrasound is very expensive, so they do urine test monitoring, LH, they monitor LH for ovulation and then they plan.
But in case of our country or India, like we go for the TVS, transvaginal sonography. Okay. So now we are going to the topics that IVF, that in vitro fertility, which is called test tube babies in general. People will understand that in case of IVF, actually what are the all indications? Because some people got frustrated if they are giving IVF, why the doctor suggested me IVF, or what are the actually indications should be in IVF?
Okay, so we'll
some malpractice also over there, because nowadays it is so many value adding cost effective treatment. So some hospitals or some maternity clinics without less skill, less experiences, they are doing all the things. But what should be the protocol, or what should be the actual proper indication for IVF?
Yeah, we'll divide the indication into male and female. So male, whenever the sperm count is very low, say less than 5 million, and motility is also very poor, less than 10% motility, definitely you have to go for IVF. Next is azoospermia. When they don't have any sperms, you have to go for IVF. You don't have. These are the two indications for male.
For male.
For male. Female, what you have to see is that we have to see the women's age. If the age is more than 35, you can be little liberal. If the age is less than 35, you can go little slow. The first important factor is the tubes. If both the tubes are blocked, you have to go for IVF. But before going for IVF, you have to confirm by doing a laparoscopy. That's the first step. The next important indication is PCOS. So irregular cycle, polycystic PCOD, whatever. So what we do is that we ask the couple to go ahead with ovulation induction for at least 3 to 4 cycles. If they don't conceive, next step is to do with injections, same ovulation induction, and try IUI. IUI for 3 to 4 cycles. If they still don't conceive, next step is to intrauterine insemination. Okay. If they still don't conceive, next step is IVF. Then there is one more important indication is endometriosis. People are actually underestimating the problem.
And
So
this is a very alarming problem, because rather than PCO and other things, endometriosis is very
very
alarming
severe
for.
problem. So
Okay.
endometriosis, the important thing we should understand is that surgery is not a permanent treatment. Even if you do a surgery, the disease is going to come again and again. There is no permanent treatment. You can't do surgery again and again. So in case of endometriosis, if it's mild, you can do intrauterine insemination. If it is severe, there is a big cyst, definitely you have to go for IVF. The reason is that if you don't go for IVF, the cyst will grow, it will go to the next ovary, it will keep on spreading, and the number of eggs will start reducing. If the number of egg reduces,
It
then
will
you
be
will not
very
get
much
good eggs in
difficult
IVF.
for
Even in
IVF
IVF, it's
also.
very difficult.
Yeah, it's difficult.
Very difficult.
So you are saying the issues of male. So if they have like any ovulation inductions drugs in like women.
Sometimes even men will have hormonal problems. It's called hypogonadotropic hypogonadism. The testosterone level may be low, the sperm is less than 5 million or even 0. In those cases, you have a scope of improving them. So you can use the same drug, clomiphene citrate, for 3 months, 4 months, and even HCG injections weekly twice to improve the sperm count. So even they have a scope. Similar ovulation induction drugs can be used in men also to improve the sperm count.
Okay, so we just did not suggest them for IVF. We first give some medication according to indication. Then if they improving, then we try for the medications and injections. Then we go for the IVF.
Correct.
Okay, so in case of IVF in your fertility center, because in Ishwarya Fertility Center is very much popular, all of the doctors and all of the patients who are going through infertility, they also know if they want to go for treatment in Chennai. So in Ishwarya Fertility Center, what you do actually with the patients actually when they come, what is the protocol you maintain for IVF or other things, and how you maintain like this?
Okay. The first step what we do is complete evaluation. When a male comes, we do basic blood test, hormone test, and a semen analysis. We evaluate complete male picture is got. The next step is females. So females, what we do is we do a routine basic blood test, transvaginal ultrasound, TVS scan. The next step is checking your hormones, thyroid, prolactin, and one more important hormone which we check is the AMH. So AMH gives you your egg reserve, ovarian egg reserve. Same like how you check for number of sperms in men, you can check for number of eggs in the ovary. This is AMH. So we finish all these checks. Then next step is to go for hysteroscopy. This is where actually we are expert in. So hysteroscopy is nothing but putting a camera inside the uterus and seeing what is the problem inside. Many doctors, what they do is that they do laparoscopy, but they don't do hysteroscopy. That's a major mistake. When you are subjecting a patient to anesthesia, another 5 minutes extra you are finishing hysteroscopy. In hysteroscopy, sometimes you may find polyp, fibroid, all these things which will be missed by scan. Scan is what is like a black and white. Sometimes you may miss small things. Whereas with hysteroscopy, you are seeing with your eyes, so you will not miss anything.
A proper way of seeing the
Seeing the
problem
uterus.
actually.
Yeah.
Okay. In case of laparoscopy, if you go for the ovulation blockage of the tubes, if we go for the laparoscopy, then what is the how you counsel the patient, because sometimes they don't want to go for the laparoscopy or some things. Then how you counsel the patient, what you say, or what are the responses of the patients?
Okay, very
Because
simple.
in case of in our country, laparoscopy is not that much popular, not for the doctor can do, they can do, they got training, they have training, but the people or patient don't allow for the laparoscopy. They want to go for the IVF rather than laparoscopy if they have any problem or anything. So what is the point of your counseling to the patient in case of laparoscopy?
Okay. Whenever your age is less than 30, definitely there is a big role for laparoscopy. You will be checking the tubes with HSG, hysterosalpingogram. So hysterosalpingogram will tell you whether the tubes are open or not. It won't give you any other information. Whereas when you do laparoscopy, you can check for peritubal adhesions. The tube will be open, but still there will be some adhesions. The tube will be attached to the pelvic wall or to the ovary. So the tube will be open, but it will not go and pick up the eggs. So if you do laparoscopy, you can clear all those adhesions. You can make the tube nicely open. That is one thing. Next, if there is any tubal infection, you can diagnose with laparoscopy. And as I told you, when you do hysteroscopy, you will be flushing the tubes. So even the tube is open, it will be nicely open. So the chance of conceiving naturally after a laparoscopy is very high.
It's very high.
Very high. And one more important thing is case selection. So which kind of patients you are subjecting to laparoscopy is important. Younger patients, very good success. But when the age is more than 35, even laparoscopy may not be the right option. And with endometriosis, definitely
So
laparoscopy is
age
another
issue
option.
is the main
Main,
concern in infertility.
correct.
Because in IVF also, in ovulation induction drug also, injection also, and laparoscopy also, it came out with less results. So in case of laparoscopy, you were saying that if the tubes are blocked without other complications, you may open the blockage by doing the laparoscopy, so that the ovulation can happen normally, or the pregnant girls. So how is the ratio, what is the ratio, what is the data you have that after laparoscopy they got pregnant? Do you collect the data in your center, or do you have any experience that it happened?
Yeah. After every laparoscopy, we follow the patient for next at least 1 year, and we try to collect data whether they conceive naturally. 80 to 90% of the couples who undergo laparoscopy with us, they follow us for treatment. Only when the couple comes from abroad, sometime we may lose follow-up. And if you see, out of 100 people doing laparoscopy, at least 10 will conceive naturally without any treatment in the next 1 or 2 months. If you wait for 6 months or 1 year, at least 20 will conceive.
Okay.
And if you give them ovulation induction after laparoscopy or do IUI,
Okay.
30% conceive. So the case selection is very important. At what age you are doing
So
laparoscopy
we
is very
have a
important.
phone call. We are receiving that after. We'll come back. হ্যালো দর্শক, আপনার নাম বলে প্রশ্নটি করুন।
আসসালামু আলাইকুম। আমি আমি কুমিল্লা থেকে বলছিলাম।
জি।
কি হচ্ছে 10 বছর যাবত।
জি।
এখন আমার মোটামুটি সবগুলো টেস্ট শেষ, বাট এই হাইপোথাইরয়েড হরমোনের সমস্যা আছে। আর আনুষঙ্গিক সমস্ত কিছু ভালো, হাজবেন্ড এবং আমার অন্যান্য সবগুলো ভালো, কিন্তু মেন্সের সমস্যা হয় আর কি।
আচ্ছা ডক্টর, দর্শক আপনার বিয়ে হয়েছে কত বছর?
10 বছর। আমার বয়স 28।
আচ্ছা, আপনি এর মধ্যে কখনোই কোনোদিন কনসিভ করেন নাই?
না না না, কোনো সময় কনসেপ্ট হয় না, অনেক ডাক্তার দেখাইছি।
আচ্ছা, তো কোনো সমস্যা বলেনি যে কেন হচ্ছে না বাচ্চা?
এখন ওনারা বলে যে হাইপোথাইরয়েড সমস্যা তো এজন্য হয়তো বা হচ্ছে না, বাট হবে বলে, কনসেপ্ট হয়ে যাবে, এই বুঝি হয়ে যাবে, এরকম করতে করতে আজকে 10 বছর প্রায় শেষ এরকম।
আচ্ছা, আপনি লাইনে থাকুন, আমরা উত্তরটি নিচ্ছি। The patient is actually married for 10 years. She is 28 years old, but she is saying that her